Hi, my name is Fee Wynn. I'm a board-certified physician assistant and the injectable specialist at Fiala Aesthetics. I'd like to answer the question for you, are dermal fillers safe and what are the side effects? So most fillers today are composed of hyaluronic acid, which is a sugar molecule that is naturally found in your skin and joints. Another type of filler is composed of calcium hydroxyapatite, which is another naturally occurring component of your bones and teeth, so no allergy is required for either products. Further, with hyaluronic acid fillers, we have an enzyme we can inject into them that completely reverses it if you're unhappy with your results or if we run into complications, making them safe and easy fillers to work with compared to their predecessors. With any procedures involving needle sticks, there always carries the risk of localized bruising, swelling, and tenderness, but those typically subside within less than a week and can easily be covered with makeup. Sometimes lumpy bumpies can occur, but with experienced injector and with correct product placement and technique, those problems are rarely encountered. As mentioned in a previous Q&A video, fillers are used to lift and smooth targeted wrinkles and folds, as well as provide structure and volume to patients suffering from age-related volume loss or from an active lifestyle. Other suitable candidates for fillers are those seeking to simply contour or enhance their features. Our goals as provider is to give you the most subtle and natural results. What I usually say to my patients is, when you walk out of my room, I don't want you looking like somebody else. I want you looking like you, just a more rejuvenated, better version of yourself. So in order to achieve the most natural results, it's important to select a well-trained provider with not only an eye for aesthetics, but who understands proper anatomy to prevent complications from occurring and to correctly place the product for the most natural results. The procedure is pretty straightforward and can last anywhere from 30 to 45 minutes, and it gives immediate, noticeable results that last anywhere from 6 to 24 months depending on the product we use and where it's placed. At the end of the 6 to 24 months, the product will gradually soften, and this is when touch-ups usually take place. So for any further questions or concerns regarding dermal fillers, please give our office a call, and I'd be more than happy to chat with you. Have a good day.